Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center. So let's talk about the pre and post-op instructions for Vaser Liposuction. So Vaser Liposuction, as you're probably familiar by now, is a procedure we do in the office. We use local anesthetic and it helps to get rid of localized areas of fat. So like for example, if you have fat in your arms or your chin or your belly, love handles, stomach, any of these areas, including the calves, can be treated. So we use a local anesthetic to numb the area, and then I emulsify the fat using ultrasound, and this selectively targets the fat, kills the fat for me, or makes it into smaller particles. And I'm able to get from the deep to superficial layers of the fat. There's less trauma to nerves and to blood vessels, so it makes it a lot less traumatic and a safer procedure. And then that fat is easily suctioned out very gently. So again, there's less trauma. There tends to be less bruising and less swelling when we use this technology as opposed to traditional liposuction. So that's why I love using the Vaser liposuction. This procedure is ideal for patients who are close to their ideal body weight and at least have been consistent in their body weight for some time, but just have stubborn areas they can't lose no matter how hard they're trying to exercise and diet and starve themselves. That pocket is just not moving or budging, or it comes back very easily because your body just tends to store fat in that area. So it's just a perfect procedure for that. So it is not a weight loss procedure, and that's something patients need to understand when they go through a body contouring or sculpting procedure, whether it's non-invasive or minimally invasive like liposuction. But it does help to shape you, and most patients do end up losing some weight, but you won't lose overall weight. So you do want to make sure that you're able to maintain yourself well after the liposuction procedure so that you don't put that fat back on in the same areas or potentially other parts of the body. So in order to prepare for the Vaser liposuction procedure, you want to make sure that you are healthy and fit, and that you don't have any medical conditions that would be of concern. In general, patients who have diabetes are okay to treat with this procedure. We just want to make sure that you're well controlled, whether you have hypertension or other medical problems, they just need to be well controlled. If you've had a recent abdominal surgery that you're still recovering from, we would want you to be recovered from that. If you're getting liposuction to your abdominal area, we want to make sure you don't have a hernia or something else there that would preclude us from doing the procedure. You want to make sure that you stay off of blood thinning medications such as ibuprofen, aspirin, Aleve, anything that thins your blood. Even the G herbs like garlic and ginkgo can do that. Alcohol can do that. So try to avoid that for about 2 weeks before the procedure, ideally, so you get the best healing afterwards with less bruising and less swelling. You also will have some labs checked by us. So we're going to check your liver function, we're going to check your kidneys, and just make sure that you're able to clot your blood normally. So we'll check what's called a PT-PTT, and that is just a lab slip that you will take with you. We need to check to make sure that you're able to flush out the lidocaine, essentially, that we're giving you during the procedure through your liver and through your kidneys. And you want to make sure that you come that day with your compression garment. So we don't have the compression garments in the office because there's so many different types. And based upon the areas that you're treating, you may need a very specialized garment. So we recommend that you get one that fits you properly. So make sure you try it on at home and make sure you're not struggling into it, because even though you are going to get thinner from the liposuction procedure almost immediately because of all the dressings and things, you will find it very difficult to get into a garment that is too small. So just make sure that it's appropriately sized for you. And that's pretty much it. I do recommend that you have a driver that comes with you as well that can drop you off and pick you back up. And especially if you're going to take any medications like Valium or Vicodin during the procedure. Now, it's not essential that you take those medications. They are merely to help you relax a little bit and just feel more comfortable. So that's completely optional to you. And in some cases, patients can drive themselves home if it's not too large of a case and we're just treating a limited area. But it's always good to have someone with you. And also, post-operatively, you will have some leaking. So for about 48 hours, I would say 24 to 48 hours after the procedure, you will leak from the little puncture points for the procedure. So there are no stitches that are placed in your skin, and the puncture points are very, very small. They usually close up within 48 to 72 hours, but you will have some of that excess fluid, some of the fat, and all of that just leaking out for a little while. So just be aware of that. Like, your garment is going to get a bit messy, and that's okay. You also cannot shower for the first 48 to 72 hours. So remember that. But you can certainly sponge bathe, and you do want to keep that compression garment on continuously during that time. So you can reach in and change your pads that you should have at home as well. And so if they get really soaked, just reach into your garment and change them out. But try not to take the garment off. Some patients can feel a little faint or lightheaded when they take their garment off because fluid can third space into the area that was treated. But the compression is very important just to keep all the tissue nicely compressed and to push all that fluid out of the area as well. One thing that you want to be especially mindful of is that the compression garment is not pinching you or creating creases in the area of the procedure. So this is really important for you to get the best outcome. I also recommend when you're sitting, try to sit a little bit more upright so that you don't slouch and then create folds and creases where the garment could potentially leave a permanent mark, especially in those early days when you're still recovering. So that is really important. If you do notice an area of creasing, you can either loosen the garment. Most of the compression garments designed for such procedures have hooks and zippers. And so you can sometimes just loosen some of the hooks while the zipper is still pulled up. And otherwise, you can also put pads under those areas where the creases are occurring so that the skin lays more nice and flat. And you can also start doing a little bit of massaging, like lymphatic drainage massaging after about a week or so from the procedure. And that's also very helpful to mobilize fluid if needed. Some patients also benefit from procedures such as Exilis Ultra or Venous Freeze, and these are both radiofrequency procedures that can be started about 4 weeks after the liposuction procedure. And the radiofrequency heat will help to soften any potential scar tissue and also just give you smoother results and give you a little bit more tightening as well. And it will also work on some areas of cellulite because, as we know, liposuction is not the ideal procedure for cellulite necessarily. We have some techniques that can enhance the outcome in cellulitic areas such as BodyTite or Vaser Smooth. So that can be done in conjunction if you have those problems, or like I said, we can use these external radiofrequency treatments that have no recovery time afterwards to get you smoother, better results. Some patients are also now incorporating doing the Emsculpt procedure after liposuction. So starting at about 4 weeks out, and we're seeing really beautiful results with that, where it just further helps to tone the area up for you and work on the actual muscle. But it'll also potentially kill any of the visceral or internal fat that's around your organs and under your muscle. Because none of the procedures where we remove or kill fat, such as CoolSculpting or liposuction or Vanquish or any of the other procedures, do not get below the abdominal muscle to kill the fat except Emsculpt. So that can be a really useful tool to give you further pinching and improvement in the abdominal area, and can also be used in the buttocks to kind of lift the buttocks and smooth out the thighs. I've actually been extremely impressed with the results we're getting from Emsculpt, especially around the abdominal area and the thighs, where we're seeing overall shrinkage and also just more tone and smoothing of the skin. So we're actually even seeing the skin tighten up because of the built-in radio frequency. So that's a bit about the procedure. You don't want to exercise or do any strenuous or heavy lifting for about 2 weeks after the procedure. But then after that, just listen to your body and wear that compression as much as you can for about a month or so. Some patients can get out of their garment within a few weeks, and then others we may ask you to wear it longer depending upon what your situation looks like. And we always follow up with you at about a week, and then we'll see you back at a month, 3 months, 6 months, and 12 months. Your results actually continue to improve and get better over time. So that's a bit about the pre and post-op instructions for Vaser liposuction. Do let us know if you have any questions at all. Always here to help and help you look your very best. Thank you so much for watching.